Today is International Women's Day and I'm hugely excited about it. This year the theme is Planet 50-50, Step It Up for Gender Equality. And that's such a good theme in the first year of our SDGs, where the global goals commit us to really achieving gender equality by 2030. I'm incredibly excited as well that this year we have Women Deliver, that remarkable conference that will bring together thousands of leaders and researchers and activists, thought leaders, to think about what we really need to do for gender empowerment. And we know that where women take leadership, where girls and women are empowered, we can transform our planet. One of the most important things we can do for the health of children is to educate girls. Women who are well educated as girls are much more likely to be healthy and survive themselves, and for their children to survive and be healthy. And despite all this achievement and everything we know, there are huge inequities. Look at HIV, for example. Amongst young people aged 15 to 24, girls and young women are twice as likely to have HIV as boys. And there are 3 million girls under the age of 19 who have unsafe abortions every year, with all of the dreadful implications for their health that entails. And then we have to think about violence. Boys experience physical and sexual violence too, but 1/3 of girls and women between the age of 15 and 49 experience physical and sexual violence in their lifetimes. These are the kind of challenges that we have and that we really need to tackle if we're going to improve the health of every woman, every child, every adolescent, everywhere. Accountability matters. And now that we've started to implement our new global strategy, I'm delighted that the Secretary-General has announced his new independent accountability panel. The IAP is chaired by Dr. Sania Nishtar. Wonderful on International Women's Day to see such a powerful woman, a former minister, chair of HeartLife, an NGO she created, and a well-renowned academic, take on this leadership. And the 9 panellists that she leads are extraordinary. We're bringing together human rights lawyers, statisticians, activists, academics, technical assistance providers from all over the world, from Brazil, from Kenya, from the US, from the UK, Sri Lanka, South Africa. This is an extraordinary team and their job is so important. Their job is to monitor what's going on, to review and analyse those results at country level and subnational level, to check that the resources that have been committed are really going where they're needed, and to make sure that human rights are not only being observed but promoted. This month, the World Health Organization declared a global public health emergency in respect of Zika virus and microcephaly. This is a very alarming situation, and it's particularly challenging in Latin America and the Caribbean, where this extraordinary rate of abnormalities is being seen. Anything that affects women during their pregnancy, of course, opens up questions about whether those pregnancies were intended and whether those women had access to the sexual and reproductive health services that they have the right to. And sadly, in Latin America and the Caribbean, we just don't have that level of access. In fact, there are 23 million women who need contraception and don't have access to it. And the estimate is that 75% of unintended pregnancies are linked to that unmet need for family planning. We also know that women from the poorest families are much less likely to give birth in health facilities than women from wealthiest households. 99% of the wealthy women give birth in health facilities, but only 71% of the poorest in this region. And so Zika reminds us of many things, but one of the things that concern us most in the partnership is how important it is to get proper access to the rights and the services to sexual and reproductive health delivery, and to make sure we strengthen those systems and address gender equality. I hope that you will celebrate the women and the girls that are making a huge difference to this planet. Take steps to ensure that the young girls and women who need opportunities get those opportunities. Opportunities for health, opportunities for education, opportunities for access to the services they need, and that their rights are really respected. On this International Women's Day, I wish you all the very best, and I hope that we can all join together to truly step it up for gender equality.